My name's Joel Penson, and this is my entry into the 2013 Health Informatics Society of Australia app contest. This app is designed to bring together information such as that available through the personally controlled electronic health record for people with chronic disease to best manage their condition. The issue at the moment is that patients need a consolidated record of what advice they've been provided with. Health providers want to control what content patients have access to, and quick access to information is needed for health providers to be able to make the right decisions and initiate treatment early. This app also has an option to allow interaction between clinicians and patients outside of a clinical consult. At the moment, patients quite often rely on paper-based reports, or they might have a red book, which is where they have a record of which professionals are seeing for different conditions. There is an option for older adults to get a personally controlled electronic health record. However, the interface is less than optimal, and it's not based around specific conditions, but rather simply a list of which professionals they've seen on what days and times. This solution makes it easier for people managing a chronic illness to see what treatment they have been provided with and what preventive actions they can take to manage a chronic illness. This would be the typical home screen that someone using the My Personal Health application would see. Conditions will be indicated on the image of the body, and then on the left hand side you can see the team of people that are assisting to help a patient manage that illness, and the patient would also get access to the options that those team members review when putting together a model of care. On the right hand side we've got what preventive actions, and this can include secondary prevention actions that a patient can take to reduce the risk of worsening of their illness. If I was to give an example of someone who may have their details already recorded, the green dots on this image would indicate conditions which are well managed. Orange dots would indicate conditions which may be worsening, or there may be potential to do some more to improve how well the patient's managing them. And red dots would indicate that there is either a high level of risk or a high potential for the individual to take action which is going to improve how well that condition's being managed. So if they were to touch the red dot in the middle of the chest, this would indicate that it's a heart condition, and the colours of the team members would change according to which members of the team have outstanding information that has not been pursued by the patient. So in this case, if the patient had seen a specialist who has some outstanding advice that the patient hasn't followed up, that would be highlighted in red. Touching on the specialist box would bring up details from the last consult. And in this example, if we were to say the last specialist they saw was a cardiologist, let's call them Dr. Reassurance, who advised the blood test results were good, there were no side effects from medication, but relaxation exercise was recommended to assist with blood pressure control. That would also be indicated on the preventive side, where the need for mindfulness support is needed to assist with that specific condition. The outcomes of this platform will be better communication between patients and their treating health professionals, but it will also ensure that information is being put together in a way that's best used for a patient. It means that information will go from a health provider to the patient and then back to another health provider. This can result in earlier optimal treatment and will ultimately end up in less risk of someone ending up in hospital and an improved quality of life. For more information on my submission, please visit my blog, the Better Decisions blog, on the address below. Thanks.